Welcome back, everyone. Our next and last presentation for this morning is from Claude Vautour. His talk is going to be about health coaching, the value of a non-clinical intervention to promote behavioral change. Claude has a Bachelor of Education and taught physical education for several years before accepting a position as a health coach at the Live Well, Bien Vivre program. Since 2012, he's contributed to the development of the Live Well Bien Vivre program, which is now recognized as a contributing factor to help improve the health of New Brunswickers. Since August 2019, the program has a new home at the Heart and Stroke Foundation of New Brunswick. Claude believes that wellness and achieving goals should provide enjoyment, should produce a sense of accomplishment, and should be individualized or based on our strengths. And I will now let Claude take over. Welcome, Claude.
Thank you, Sarah. For anyone who's ever presented or spoke publicly, introductions are always the worst part, but thank you very much for that warm introduction. I am the Senior Manager with the Health Services Division at the Heart and Stroke Foundation of New Brunswick, and I'm proud to say that I've been part of the original team of health coaches in New Brunswick back on November 13th, 2012, excuse me. And I've been with the program since the very beginning. And so I don't know if people on the call are aware, but New Brunswickers are able to access our services at no additional cost through funding from government of New Brunswick, specifically the Department of Health of New Brunswick. So anyone living in New Brunswick, 19 years and older, could receive support in order to improve their health via lifestyle changes and lifestyle goals. It's a very well-known fact within the healthcare industry, but still some New Brunswickers are not aware of our services. And so this is a wonderful opportunity for me to be able to share with you, what does a health coach do? And more importantly, why is it so important to have roles that are non-clinical in order to support clinical services? And when we talk about clinical services, there's a wide range of roles within that clinical field. But having somebody that's non-clinical could play a significant role in order to improve a person's well-being. Today, what we will do is we're going to discover health coaching principles. I will be using today a case study that is hypothetical, but I do believe that case studies are a great way to learn about the experience that a client or a patient would experience. We're going to understand concepts of motivational interviewing and self-efficacy, and we are going to make a link between respiratory rehab and health coaching. And so for the people on the call, in New Brunswick, we both have cardiac rehab clinics all across the province, but also respiratory rehab clinics, oftentimes that are happening in the same location all across the province as well. And we are linked with those clinics all across the province. And so today, this kind of journey of ours will be to discover what a health coach could support in order to leverage the experience that a patient would have had in a rehab center. All right, so you've been listening to me for a couple of minutes, and I've been saying coaching, health coaching, and some of you might be saying, well, what does that do? And before I go into what's on the screen, I want to refer to you, what is your concept of coaching? The concept of coaching might have been born probably in your youth, right? And for most people, an experience of a health coach is somebody that structures, that tells people what to do, that limits, that might be, passionately encouraging you to do things, maybe sometimes in an assertive voice or an aggressive voice. That is the opposite of what health coaching is. Health coaching is about listening first. It's about seeking to understand without judgment. It's about trying to encourage a person with positive reinforcement. And so health coaching is, for a lot of people, when people call me initially to access our services, they often jokingly say, well, I hear you're going to kick my butt or tell me what to do. No, that's not what we do. We're here to listen first. We're here to understand and to show empathy. And what health coaching, if we look at behavioral psychology, there's really two different approaches in psychology. There's the therapeutic approach. So therapy is the current moment to better understand the past and your emotions that are attached to your past. Coaching is the current moment to better do in the future. So we really focus on the knowing, but more importantly, the knowing how. And so knowledge alone doesn't equate to behavior change. Knowledge alone will not improve your diet. Knowledge alone will not increase your level of physical activity. Knowledge alone will not improve the way in which you manage stress with healthy coping mechanisms. Practice will. And that's the knowing how. That's the skill-based piece. And so for a lot of patients in New Brunswick, they've been experiencing unhealthy behaviors for decades. And they access knowledge and they turn around and are not doing any better because they don't know how to get started. And that's the knowledge piece. This is why coaching is so important. Guiding a person through a process of doing differently while they might know differently, but they don't know how to implement it and to break it down. Looking at this case study, this is, again, a hypothetical case study. Let's look at Simon Ouellette. Simon was a 46-year-old male paramedic. He's successful. He's the chief of his department. And that all matters, and you'll understand why a little bit later. He's divorced over the past 5 years. So he's gone through some sort of grieving process of a divorce, right? He has 2 children. So he's a parent. He's Francophone, and he's originally from New Brunswick, but he now lives in St. John, New Brunswick. And so probably is living in a minority environment in terms of linguistics. He has a small social network due to the frequent moves from one region to the next. So socially, if you look at social determinants of health, there's some good things here, and there are also some challenges with his social determinants of health. May I point out that obviously if he's a paramedic, he's post-secondary educated as well. So there's a lot of positives and there's some challenges there. Looking at some of his health history, he has been depressed since his divorce. So if I look back at the years of his divorce, we're looking at 5 years. So now that he's still feeling depressed since his divorce, we could be talking about chronic depression here. I'm not saying it is. I'm not saying it's not. He does have a diagnosis of high blood pressure. Again, he's 46 years old. So over the past 10 years, he was diagnosed around 36, which is, we could argue that it's a little young. Cardiac problems, of course. And obviously, since he's a smoker, he has some issues as well with his breathing, and his father passed away. So genetics plays a part in some of his challenges. So his father passed away sudden cardiac arrest in his 50s. He's been a smoker for most of his life. And so since his 20s, he often eats fast food at restaurants. He does work out at a gym when he can, but since his respiratory rehab process, he has not been going to the gym. He has a high level of stress. And of course, if we're looking at healthy lifestyle habits, there's a lack of consistency with over the past 10 years. So he's had some challenges in his life. He's had some good things. There's also some challenges when we're looking at social determinants of health markers. So let's look at now stages of change. I know there's a lot on this screen. There's a lot happening. Let me walk you through this. So looking at people that want to make change, they go through different stages. They go through different moments in their minds. These moments are not the same in length. Sometimes it could last 1 second. Sometimes it could last 10 years, right? So people who are, so I'm going to point to the bottom left of your screen, people who are in pre-contemplation. These are people that are saying things like, I won't do this or I can't do this. They're in denial. This is where the downsides of making change outweigh significantly the upsides of making change. So the pros and cons, right? So in this stage, people usually don't access care. They don't reach out, they don't talk about it, and they are quite defensive at having the conversation about whatever changes they could do in their health. Now, in the upper left corner of your screen, people who are in contemplation, people that might say, I might, but I have to kind of debate it. This is where, when we talk to people who are in contemplation, we hear a lot of yes, but, and then the counter argument. So they're almost debating in front of us, in front of our eyes. So they're somewhat ambivalent, and this is where the pros and cons might be somewhat equivalent. And it is through motivational interviewing and through coaching principles, this is where we can convince people of the value of making change by focusing on the upsides and the pros, by also limiting the impact of the downsides. People who are in preparation are people that are actually making a plan, right? So they're writing stuff down, they're setting expectations. Tomorrow I'm going to do this, or I will do that. And so this is where we've convinced people to make change, and they're now looking at strategies, evaluating barriers in order to effectively make change and finding solutions to those barriers. Now, in the decision balance aspect of things, in the upper right side, this is the action phase. It's quite self-explanatory. People are actually doing it. And this is where positive reinforcement is most successful at making sure that consistency and continuity is happening. Last but not least, the maintenance stage is where we're not trying to improve the level of behavior, but we're trying to maintain through time and find that consistency piece. Over the years, I've seen these models many times, and I've seen these explanations many times. And through my experience of the last 12 years, I've realized, especially over maybe the last 4 or 5 years, that the most important stage to understand out of Prochaska's readiness of change model is not any of the ones that I just presented to you. It is the relapse stage. Everyone relapses. We have to start normalizing that stage of our behavior change. Everybody has a bad day. Everybody has a bad meal. Everybody has a lazy Sunday on the couch. Even the healthiest personal trainer has a lazy Sunday on the couch. Even the healthiest dietitian has a donut. But how quickly does she bounce back, or he bounces back, or they bounce back into an action stage, right? So you don't have a bad week or a bad month or a bad year or a bad decade. We have a bad day and move on. And so we have to start educating our fellow New Brunswickers about it's okay that you've had a relapse. But instead of being disappointed about the relapse, let's get excited about the rebound. Let's get back into that action state. Let's spin around that wheel and get back into that upper right quadrant, into doing better, right? So it's so important to educate people to normalize relapse, not get disappointed over it, but get excited about rebounding back into doing better, right? So let's look at this through, again, Simon. So when we talked to Simon, we asked him an open-ended question, and we said, what do you think about maintaining your physical activity levels now that you finished the program? Now let's look at what his answers were. I would like to, but lack of time for me prevents me from being 100% invested with that goal. You see the but here, right? He's arguing, so he's contemplating, he's not sure. I don't want to transfer that bad habit to my children, but sedentary behaviors are part of my life since so long. Again, the but. I could maintain, but I don't see the benefits. Only lots of sacrifices. So he's contemplating, he's bringing counter arguments to wanting to make change, but he's also starting with the argument of wanting to make change. We can also look at this particular stage of change as he has personal connections and probably values that are connected to wanting to make change, because he talks about his children. And so obviously the role of a parent comes into play. He talks about his values. Remember, we're talking about a paramedic here, so obviously good health is important to him, right? So when he talks about his level of investment, and he talks about the benefits to making change, there's a debate there that is definitely obvious. So let's look at what these meetings with the health coach look like, because throughout these meetings, Simon went through various levels of self-efficacy. Now, some of you might have heard about self-efficacy. Self-efficacy is a fancy word to say the selective motivation to effectively make change and the selective confidence to effectively make change. So I could be very confident and motivated in my abilities to eat healthy, but I could be very unconfident in my abilities to exercise, right? I have a bad hip, so arthritis, etc. So there's all kinds of different, that's why I'm saying selective motivation and selective confidence. What happens meeting number one? Well, the first thing that happens is we go through what we call a partnership agreement, where we explain exactly what the role of the health coach is and what the role of the client is, because we want to create a partnership. We want to create a collaborative approach between the client and the health coach so that we are working together for the benefit of the client's goals. And this is obviously client-led. We do an intake survey where we ask questions, general questions around their health, but more specific questions around their lifestyle. So we really want to look at process-based thinking here, not the outcomes, not how much pounds we lose, not 120 over 80, not a glucose level or an A1C of 7. We're looking at what you're eating or how much you're exercising, how you manage stress with healthy coping mechanisms. So we're really looking at the process, at what they do. Obviously, at exploring this and taking a lot of time to show empathy, there's a relationship of trust that develops. When you show genuine empathy to a person that's going through a hard time, not only are you not talking and listening, but you're valuing what they're saying and their lived experience. And so it is vital that we listen to our patients, that we take the time to seek to understand. In that first meeting, obviously, we explore needs, internal motivations of why they want to make change. We evaluate the stages of change and where they are in terms of their ambivalence or the pros and cons. Obviously, if they're at the first meeting, they're probably in a contemplation stage. They're not in pre-contemplation. They're willing to explore this, right? Because they've made it to that first meeting. We practice a lot of active listening through motivational interviewing tools. We do a lot of reflection, validations, asking open-ended questions, and we, more importantly, normalize where they're at emotionally. Obviously, when you seek support to make change in your life and your health, there are strong emotions that are attached to it, and it's probably not the first time they've tried to make change. And so we do deal with people who bring baggage in terms of their self-perceived failures of the past. In helping Simon to make change, we actually gave him a tool that he completed in between meetings, where we actually asked him to write down the pros and cons of whatever change that he seeked at doing, right? And so that obviously was a great tool and conversation piece to start the second meeting. In our second meeting, we did a goal survey, and that's a fancy way to say that we evaluated their motivation and their confidence and their knowledge as it relates to the specific change they wanted to make. We looked at his priority, and that was physical activity. We gave him the Canadian Physical Activity Guide, and we discussed that, and we discussed the transition between respiratory rehab, and we talked about also his starting point. His starting point was unsure. He was not sure, even though he went through respiratory rehab, exercising on his own brought a lot of fears. You may know people like that because of their chronic condition or conditions that have some fear attached to making change. And fear is a strong demotivator, obviously. So the health coach did in this context is that they encouraged the patient to reconnect with their physician. Let's talk to your doctor about physical activity on your own, and is it safe for you to do so? After discussion with his family doctor, the client was ready to set a goal. Yes, it's safe for him to exercise according to his physician, but yet we have to start small and we have to start conservatively in order to make sure that the person has success. We wanted Simon to have success because he's not in that respiratory rehab context anymore. He's on his own. And so exercising on his own, even though he might be exercising in a room full of people, you're still kind of on your own, right? So we wanted to make sure that his motivation and his confidence is high. Now, in that preparation stage in our third meeting, we used a standardized action plan. There's two models that we use. You may have heard about the SMART goal model: specific, measurable, attainable, relevant, and timely. That model is very popular, but I actually prefer the Stanford model of coaching because of health literacy. The questions that you see below at the Stanford model of coaching, everyone understands these questions. Not everybody would understand the term relevant or attainable or timely, but why, what, how much, when, and how often, everybody understands those. Let me show you what an action plan might look like. This is one of our action plans that we use with our clients. It brings structure in asking questions about what, for example, walking, how much around the block, when, before lunch, how many times per week, 3 times a week. So you see that it brings a little bit of structure. It could bring a little bit of structure in terms of also barriers and solutions to those barriers. So this is where we would write that down and talk it out with the client so that the client can leave with something specific and tangible. The client comes back after that first week of setting goals, and what's most important is not what you didn't do, right? So most people, when they set goals and they come back and they want to talk about it, they want to talk about where they failed. And that's actually a mistake. The right approach is to talk about what worked. We want to focus on positive reinforcement and positive behaviors. Where were you successful? Let's talk about why you were successful. Let's talk about what you did so well. And so looking at the strategies and the solutions to the barriers that the client, that Simon applied, is really the way to go. And so through a process of 1 hour of discussion, we can really pump that client up. We can really motivate that person because we're ecstatic about the positive behaviors that happened. And so this is where that coaching piece starts to come in. Note that the gap between meeting number 3 and meeting number 4 was short, right? We want to have short goals, easier to achieve, more momentum being built, more meetings early on so we can build up positive momentum. So that meeting number 4 was really positive. That client left really ecstatic because we really focused on where Simon was successful. And we were able to counterbalance that, or to balance that with facts. And so it's so important when you're especially when you're starting setting goals, is to track your progress. Again, an example of a tracking sheet, very simple, the days of the week, checking off comments or what they accomplished. It would be very simple for Simon to track his level of cardiovascular exercise using a tracking sheet like this. Uh-oh, something happened. Simon had a bad couple of weeks and he relapsed. And so this is where coaching is so important, because this is where we can actually help the client, help Simon normalize the fact that life happened. It's okay. Let's get back on track. So what is working right now? Not everything is wrong. What's working? How can we leverage what's working? By doing a lot of affirmations and reflections. So affirmations are statements that you're doing a very good job despite the fact that you're struggling right now, right? So we're trying to reorient the client so that we can get back on track and speed up the process of doing better. So behind that, there's a lot of learning that needs to happen? Why exactly did you fall on track? What was your trigger, and how can we use that understanding so that we can move forward with better strategies so we can bounce back into that action phase? Again, I don't want to stress this enough. Relapses, bad days happen. It should not be the deal breaker. It should be the, okay, I gotta get back on track. It should be about rebound, not relapse. Obviously, that coaching session at meeting number 5 was very effective because the 2 weeks later, we discussed the fact that, hey, you did get back on track. Fantastic. That's really positive information. And so this is where we talk about, well, why did you get back on track? How did you do this? And so obviously, that assisted with meetings with their family doctor and their healthcare team made it so that he had such momentum built that he wanted to now look at more of a long-term goal. And in meeting number 7, what happened during the past month was the fact that he gained a lot of consistency, a lot of motivation to maintain long-term, and a lot of confidence in his plan and his ability to maintain long-term. And ultimately, the setback of meeting number 5, or before the meeting number 5, proved to him, but more so the rebound after meeting number 5 proved to him that he had the tools to maintain this long term. And so obviously this is when we want to do a second survey, which is the goal survey is the before, the outcome survey is the after. And so we want to evaluate how motivated they are, how important it is for them to maintain, how confident they are in their own abilities to maintain, the knowledge that's required in order to maintain, and the impact that it's had on their health. And we do this on a scale of 1 to 10, right? So we ask them to grade themselves in order to do this. Remember, health coaches are non-clinical roles. So it doesn't need to be a clinical assessment. That our family doctors and our clinicians are very good at doing that. So the role of the health coach is more so the behavioral psychology piece, that self-efficacy piece. Again, self-efficacy is selective motivation to make change and selective confidence to make change. And lastly, what we did at the end of the relationship with the client is we did an exit survey that is very similar to the intake assessment, which is general questions around their health. So where are they at this point? And then more specific questions around their lifestyle. So we get really a progression or an improvement piece with that before and after lens. And of course, we explained to the client that if ever they would need our support in the future, that they can certainly come back if they have needs in the future to get supported by a health coach once more. Values of health coaching. It is important for anyone on this call to know that self-referrals are possible. In terms of a client can self-refer to our services. Again, there's no cost to these services. Your tax-paying dollars have already paid for it. Might as well use it if you need it. Anyone living in New Brunswick, 19 years and older, can have access to a health coach at no charge. Remember, though, that if ever you or somebody else in your circle would like to get support, it usually takes 2 to 3 points of exposure before a person actually self-refers, right? So it's not easy to ask for help. It takes a lot of courage and a lot of strength to say, you know what, I can't figure this out on my own. I need somebody to help me out. Direct referrals for clinicians are possible. It is a complementary service to any sort of rehab program. And a health coach can help the process of building momentum for a person that would lose their momentum through any sort of transition. Goals of one-on-one support. So basically, we create personalized action plans specific to the reality of each New Brunswicker, depending on their health outcomes, depending on their situation. Obviously, I've quoted the social determinants of health a while ago. So obviously, we take those under consideration and evaluate how to build a personalized action plan. It's really about setting short-term goals and building block process. So a lot of people know where they're at, and they know where they'd like to be, but they're having a hard time breaking down steps to where they'd like to be. And so this is where health coaching is really effective. We formulate strategies to overcome barriers, but by using people's strengths, right? We're not trying to build from scratch. We're trying to really use people's strengths. Obviously, by a process of success, we build confidence to make changes that are long-lasting. 81% of our clients not only meet their goals, but maintain their goals long-term, even after they finish working with us. There are no maximum amount of meetings that you can have access to in order to meet your goals in terms of number of meetings with a health coach. So we take the time that's required in order for you or a patient to actually gain success and figure things out. Obviously, by taking better care of yourself, by setting goals, meeting those goals, building that positive momentum, you're probably more likely to increase adherence to treatment with your clinicians, right? You're excited to go back to see your family doctor or your clinician because you have a good story to tell. So all of this is really done in a partnership, in a collaborative way that really creates a lot of success. One last statistic I may share with you in looking at our annual and biannual reports and the data that we collect, 40% of our clients initially set goals that are related to better managing stress with coping mechanisms that are healthier for them. 36% of our clients meet with us to increase physical activity levels, and 29% of our clients meet with us and want to set goals related to healthy eating. And now you might do the math in your head and say, well, that's more than 100%. Yeah, because a lot of clients work on multiple goals through a relationship with a health coach. So there is that multifaceted kind of behavior change process that could include multiple improvements within a person's lifestyle. So, Sarah, that was my part. I don't know if there's any questions or...
Well, thank you so much. I'm not seeing any questions yet, but I have a couple comments and maybe they'll pop up.
Sure.
First of all, I think that we all probably really identify with the stages of behavior change and relapse because that's certainly something we've all had happen before. But I think that the action plans that make it achievable and celebrating the successes and that you just start again is really good because it's so easy to think I went off the wagon, so to speak, and hard to get started again. So those are great programs.
Well, thank you. And may I add, Sarah, you're right. Change in our lifestyle is not linear, right? And most people, that's what they want, right? How many people have we heard say, well, I just want to be consistent? At best, what you can hope for is to be consistent with your inconsistencies. But the triggers that we have will be the triggers that we have. But it's more importantly to figure out how to navigate through that process of, okay, I've had a bad afternoon. How do I get back on track tomorrow morning, right? Yes. And so that's really the key because we're human beings. We're not perfect. We're not machines, right? So for a lot of people, that's where the unrealistic expectations begin and end.
Mm-hmm. I think it's easily relatable to anyone who's ever gone on, I don't want to say the word diet, but a food plan where they're trying to eat healthier, and you miss one and you think, okay, I'll start again Monday, but really you could just start again on the next meal, which would be more beneficial and keep you on track further. So I think that the health coaching is a really great free program for people in the province. Is it all throughout the province or do they just meet virtually with you? I don't know if I missed that part.
I'm going to go with the word yes, both. So we are spread across the province. We have 8 different offices all across the province. We are integrated with a multitude of multidisciplinary teams across the province. For example, at the Dalhousie Community Health Center, our health coach meets patients there once a week for a full day. So that's an example of us integrating the healthcare system. I'm not going to bore you with the hundreds of examples that I have, but so we're across the entire province. professional office spaces, but we do also see people virtually. Obviously, let's not go back and relive the pandemic. We were 100% virtual at points and times during that moment, but still in 2024, we're still about 65% virtual. Most New Brunswickers, by 65%, that's a majority, most New Brunswickers have learned to appreciate the virtual reality when it comes to accessing care. And I mean, it has some advantage, such as travel time, travel cost, but also meeting with your health coach in a non-traditional business hour setting. So for a lot of New Brunswickers, getting away from their work or their priorities and their responsibilities is just not possible during the day. And so seeing your health coach at 7 p.m. on a Thursday night or 10 a.m. on a Saturday morning. So all of our health coaches work 35 hours a week, but on a flexible working schedule. So we really make it easy for people to access care and build momentum.
That's really great to know. Thank you so much. That was very informative and helpful. And I'm sure that everybody who's listening got a lot out of that and will be able to forward that to people. So thank you so much for being here today and for your time. We appreciate
Thank you very much, Sarah. It was a great opportunity for me, and thank you very much for your time.